Good afternoon, participants. Thanks for joining. We are waiting for our speaker to join the session. Once we join, we'll start the session. Thanks for joining and your patience.
Ready, Grandma? Yeah. Yes.
Hello, doctor. Uh, Sir, ನಿಮ್ದು unmute ಮಾಡ್ಕೊಳ್ಳಿ.
Hello,
Yes, doctor. ಕೇಳಿಸ್ತಾ ಇದೆ.
I'm audible.
Yes, doctor. You are audible. Doctor, could you please just try to present your screen now?
Yeah. Not able to. Hello.
Doctor, are we ready? Can we proceed?
One sec, ma'am. I'm just unable to share my screen in this MacBook. Just try it.
Uh-huh. Yes, yes, sure, sure, doctor.
Receiving
We'll
on
wait.
this. Can I WhatsApp you so that you can share it?
Yes, doctor, I could do it.
I sent you in WhatsApp.
Yes, doctor, I guess it may be still uploading.
Yeah, it came
So,
now.
yeah. Yes, doctor, I'll just open it and start
Yes.
sharing the screen.
Yes.
Doctor, I guess is it it's visible now, right?
Yeah.
Okay. Okay, doctor, we shall start the session.
Yeah.
Good afternoon, everyone. Very warm welcome to today's Insight, continuing Ayurvedic education session, sponsored by Ayur Central and co-powered by Ayurveda One. I'm Dr. Usha, and it is my pleasure to host today's session. On behalf of Ayur Central and Ayurveda One, I extend a heartfelt welcome to all the doctors, practitioners, students, and Ayurveda enthusiasts who have joined us today. The vision behind Insight is simple yet meaningful: to create a platform where authentic Ayurvedic knowledge is shared, clinical experiences are discussed, and practitioners come together to learn, grow, and strengthen the practice of Ayurveda. About our organization. So, before we begin, let me briefly introduce our organizations. Ayur Central Ayur Central is proud to be a pioneer in organized Ayurvedic healthcare. What began with a single clinic in Artinagar, Bengaluru, has today grown into a network of 72 clinics across Karnataka, supported by a team of more than 120 experienced Ayurvedic doctors. Today, Ayur Central stands as India's largest Ayurvedic clinic chain, serving patients through both physical clinics and a robust digital presence, with a mission to make authentic Ayurveda accessible, trustworthy, and impactful. Ayurveda One, our sister concern, is dedicated to manufacturing quality Ayurvedic formulations that combine the wisdom of classical Ayurveda with modern quality standards. With a focus on consistency, reliability, and clinical applicability, Ayurveda One strives to support practitioners with formulations that help deliver meaningful patient outcomes. So, before we start the session, here are the few quick announcements I would like to announce. So in our chat box, you can see uh, WhatsApp channel. So I request all of you to kindly join our WhatsApp channel to have further updates both on the upcoming webinars as well as our YouTube channel for the missed sessions. And I'll also be posting a Google form on our chat box. So this is for your registration for the certificate because we receive a lot of registration for the webinar, but the Participation certificate will be given only to those participants who make their times for attending the webinar. So I kindly request all of you to register through this Google form so that there will be no delay in sharing the participation certificate with you. You may also post your questions in chat at any time during the session, but it will be answered only during the question and answer segment. And I also request you to stay in a good network zone so that the session can be attended seamlessly. So today our topic is chronic inflammation and Ayurvedic management. Chronic inflammation has emerged as a significant underlying factor in several lifestyle, metabolic, autoimmune, and degenerative disorders. Today, our speaker, Dr. Swagat Narayan, will take us through the Ayurvedic understanding of chronic inflammation, its correlation, and share practical clinical approaches for its effective management. So, it gives me immense pleasure and privilege to welcome Dr. Swagat N, an eminent Ayurveda physician, academician, and clinician, as our esteemed speaker for today's Insight session. Dr. Swagat N is a renowned practitioner with over 24 years of clinical experience in Ayurveda, with expertise in Kaya Chikitsa, Panchakarma, Marma therapy, and holistic disease management. He is currently serving as the Principal and Chief Medical Officer at Sri Paripoorna Sanatana Ayurveda Medical College, Bangalore. With a distinguished academic career spanning several years, Dr. Swagat has served in various academic leadership roles, including Professor and Head of Department of Kaya Chikitsa, contributing significantly to Ayurveda education and clinical practice. His clinical interests include Kaya Chikitsa, Panchakarma, cardiac disorders, lifestyle related disorders, oncology, supportive care, and rasayana based approaches. He has actively contributed to the Ayurveda fraternity through scientific presentation, guest lectures, and academic discussion at national and international platforms. Dr. Swagat's contribution to Ayurveda have been recognized through several prestigious honors, including the Karnataka Vaidya Ratna Award in the year 2021, Star Performer Health Service Award in the year 2022, and Vaidya Brahma Award in 2022 for his contribution to healthcare and Ayurveda practice. He is also the author of Illustrated Textbook of Roganidana and Vikriti Vignana, an important academic contribution aligned with the new NCISM curriculum. With his rich blend of clinical experience, academic excellence, and practical insights, we are honored to have Dr. Swagat and with us today. We look forward to gaining valuable perspective from his extensive clinical wisdom. Welcome, Doctor. The session is yours.
Good afternoon, everybody. My dear fellow colleagues, dear students. I wholeheartedly thank Ayurveda One for giving me this opportunity to share my experience regarding a topic which is given. Also, wholeheartedly share my thanks for my friend Dr. Manoj, and with the blessings of our Guruji, Sri Srinivas Swamiji, and my Guru, Dr. G. Srinivas Acharya, and all the gurus, I start my presentation. Next slide. Today, when the Ayurveda One people asked me what was your topic you wish to do, I said it's your choice. And they gave me a beautiful topic called chronic inflammation and its management. I was really shocked, to very frank with you. Oh, chronic inflammation is not at all a disease. Why should we speak on that? What is the role of chronic inflammation? Just an inflammation, and according to the presentation, we go for the treatment. But after diving deep into the subject, I understood that there are more than 60% of the global death happening just because of this silent killer. If you understand, whenever we do research in PG or when the scholars do research, we say cardiac illness is the number one killer, diabetes is a silent killer, and paralysis is the killer, or many things will go. But if you go again, still dive deeper, we understand that 60% of the global death is because this silent killer is chronic inflammation. Next slide, please. So if you see these 3 out of the 5 lives are claimed by this killer, and this chronic inflammation has become the leading mortality cause in globally now. Next slide. Now, what happens if you understand? We all know, we study in your second year what is inflammation. Anything which is coming with itis, bronchitis, cellitis, all this itis is inflammation. So, what is inflammation? Inflammation is an bioresponse of our body to any injury. Let us say in the word any injury, maybe physical injury, mental injury, whatever injury happens to our body, there is an injury. Then what happens? This biological dysfunction will be there for a healing process. We all know that there are certain phases of the different phases going on in the inflammation. The last phase is the repair phase. How the repair happens, we'll see later. Repair phase. When there is a repair phase doesn't happen in our body, then that healing process is not happening. That is called as biological dysfunction. And this dysfunction becomes a persistent threat to the body. Okay, what happens is how we'll see. Next slide, please. So you can see this. This is why we say that there is a very much. This is a very, you might have seen this iceberg image in many things. Usually we see this for an psychological illness. We put this. I have included this because even the chronic inflammation is also like this. Externally, it looks very small and simple, but if you dive deep, it is very deep hidden in your body, so that it is killing your body inch by inch. But this is the visible trap of this chronic inflammation, which you cannot see. The tip is very small, and the hidden drivers, if you go dive deep, it is just like in Titanic, how it wrecked. Your body may also have that wreck. Next slide, please. Today, what we are facing is the modern environment. The olden days environment is entirely different. Today's environment is very different, and we are into it very biological, psychological, dietic stress, sleep different. Where sleep different? Many will have night duties. Many people cannot sleep because of today's mobile gadget. They sleep 11 o'clock, 12 o'clock, sometimes 2 o'clock. And some are the web series. You might have seen many web series. It makes you very curious to complete the web series, and they sleep very late because it is almost 4 5 hours and they sleep tight. And some have US customers, and these US customers, the timing is totally changed, and they want their customers and do chat with their customers, and you are sleep deprived. All these are happening, and if you see after 35, many people are suffering from different diseases or maladies which are very much having the impact on the body. They are not having any bad habits. Still, they are diabetic. They don't have any bad habit. There is liver is fatty liver. Most of them are having fatty liver. Many things which we are having because of what we call modern stressors, and because of this modern environment. What we go out, have some food, and for example, if you want me to ask, cake is very much famous nowadays. If New Year you go to a bakery, there is no cake available at all. Why? There it is so much of sold, and they put colors to added colors. They say it is a pineapple color, but it is a colored food. The body doesn't respond to it. These are the chemical hazards what we're filling it. So this is modern life, because of which modern stress is also there. Next slide. Next slide. Yes. So this is general, you all know. What is inflammation? Inflammation is a complex response of our body. What happens there? There is, you all know, there is rhubarb, agar, calor, and there is a loss of function also is there. This is the basic inflammation. Inflame means there is a fire ignited. Okay. How the fire ignites? Let us see. And this inflammation is of 2 types. One is chronic and acute inflammation. And if you understand this acute and chronic inflammation, we will see what happens. But very basically, if you see, the acute inflammation has got different phases of inflammation. Next slide. Now, after this, chronic inflammation refers to prolonged response. Now, what is prolonged response? There is a last phase. Repeatedly, the body is trying to repair itself. The tissue repair happens, but it is not happening. So every time it goes on to the cyclical process, and that cyclical process hits your body, and when the body hits, it cannot repair. And there's a repeated attempt of repairing, and that repairing is not happening. Again, it goes to the first phase, and there is an injury. It happens. This phase goes for a chronic duration or a longer duration. It becomes a chronic inflammation. Unlike acute inflammation is very simple. A short duration of time, it is over, and the body heals itself. How it heals? There are two types. One is there is a natural structure is regained. Next is fibrous tissues happen. There is a scar mark, as we say, scar mark, fibrous scar mark may be there, and that is the inflammation is over. But whereas this chronic inflammation, it goes months to weeks. Now, what happens? You will see. Next slide. So this acute inflammation, this may follow of three varieties, three ways it happens. What are the three phases how it happens? One is it is following the acute inflammation. Next is the repeated inflammation is happening, repeated injury. For example, best for example you can say for cholecystitis. The gallstone is formed and there is a repeated infection happening there or inflammation happening in the gallbladder, cholecystitis, one form of your chronic inflammation. Next is low-grade infection is always the subclinical infection. And because of subclinical inflammation, there is a repeated inflammation in the body which is causing the chronic inflammation. One more variety is de novo chronic inflammation. What is de novo chronic inflammation is the chronic inflammation is directly happening in the body. How we'll see, discuss now. This is, no, don't go. There are many things. Once a patient comes to you, you have to identify him. There is a persistent infection is there, or the person is having immune-mediated cells is produced. No, if you happen to have a chronic inflammation, you have certain symptoms. These are the commonest symptoms, that is fever, mouth sores, rashes on the body, abdominal pain, there may be chest pain. These are the symptoms. This happens mild to severe, and this is the commonest symptom. Next slide. Now you can see the causes. What are the causes? One is persistent infection. The infection is not going. The body is unable to clean your body. Hypersensitivity diseases. You all know that allergic dermatitis, allergic bronchitis, all these allergy, immune-mediated related inflammatory conditions. Prolonged exposure to toxic agents. Repeatedly you are exposed, knowingly. And for a best example, I can quote is the painters, the one who have the paint. They are repeatedly exposed to that chemical which is there in the for painting. Next, chronic inflammation followed by acute inflammation. Again, that is bronchitis. Bronchitis is the best thing what I can suggest to. Repeatedly there is an infection, allergic bronchitis. Because every now and then is exposed to simple small dust also is exposed, is bronchioles become inflamed, and that is repeatedly happening and it becomes chronic bronchitis. Recurrent attacks of acute inflammation. Suppose he is getting injury somewhere in the inside the body or exposure to toxic chemicals. Chronic inflammation, de novo. Next slide, please. Now, what happens if you see inflammation has got certain things happening in our body, that is biofeedback mechanism. Whenever there is an entry of any foreign material in the sense that is an inflammation to happen, what happens? There is an injury. Whenever there is injury, the body sends signals to the brain, and there is two things happening in the acute phase, that is the cellular version as well as vascular deviation. In the cellular, totally there are 11 versions. We will not discuss that. There's the primary thing in the organism that we will not discuss now. But there are certain cells which are involved for chronic inflammation. What does these cells do? They have the scavenging or the cleaners. They are the cleaners or the sweepers of our body to clean all these idiots which come inside the body because of nonsense. So what are they? They are mostly macrophages. Macrophages are the primary most 60% of the element is of the macrophages. And macrophage, next is lymphocytes, plasma cells, mast cells, and the neutrophils. These are the protective things of our body. And what they protect our body by cleaning all these elements. While the process of cleaning, when there is too much of cleaning, what they'll do, how we sweep and we pour it in garbage bag and tie it and throw it, they also do the same thing. that they're cleaning and sweeping and throwing it. And while doing this, there are certain things happening in the body. We'll not go in detail with the pathology. Phagocytosis happen. During the phagocytosis, there are proteins which are released, and these proteins, they bind them, and there is a granulomatous formation. Next slide, please. Macrophages, see, they do the phagocytosis. Initiated tissue repair and display of the antigen is there. Antigen antibody reaction happens, and whoever wins the phase, it goes on to become the repair phase, or the chronic inflammation is over. Next slide. Now, certain macrophages, they are named differently. In liver, it is called Kupffer cells. Bone, it is called osteoclasts. Lung, it is called alveolar macrophage. Spleen, it is called sinusoidal lining. And inflamed, it infiltrate macrophages. Next slide. They are good cells. They are not bad cells. They are good cells. But the end product of that is the bad. That is granulomatous inflammation. Especially this is most important. Whenever you have a, what is granulomatous? There is a granuloma formation. It ties in a bag all these bloody idiot elements and all chemicals which is there. It ties it in a bag and throw out of the body. There happens a small granuloma. It may be internal granuloma or foreign body granuloma. And these foreign body granulomas, again, there is a giant cell formation. It's a huge thing to discuss. Not a basic thing is not required, but still there are multiple series of chemical reactions happening in our body because of this inflammation through macrophages. Next slide. Now, once there is an happening of this chronic inflammation, clinically you need to identify it. When how to identify inside the body? We cannot see the person looks very healthy, but he is very lethargic. He doesn't have any strength. All this happens. Now you want to go with a primary blood test. What are these blood tests? Biomarkers. There are two types of blood tests. One is specific blood test. One is sensitive blood test. The primary sensitive blood test, what we can see is the CRP. What we do many a times, C-reactive protein, which is very simple test which you can perform to identify even a lowest grade of the systemic inflammation if it is there. This, why it happens, it is also checking all the things, especially the interleukins. Interleukin 1 to 12 is there, but interleukin 6 is most dangerous one. So it will identify that also. Interleukin 6, cytokinins, all this is identified, and then it is exclusively showing that CRP is present. Positive or negative. There is a ratio which I have put already. You all know in the blood administration. Next slide. Next one is the ESR. We all know in general CBC, if you go complete blood count, we will get the ESR. ESR is varied. This is a sensitive, this is not sensitive test. This is a sensitive test, not a specific test. It doesn't show anything where is inflammation. It shows there is an inflammation ongoing. Where it is, we don't know. This happens even in autoimmune. It is raised in even in tuberculosis. It is raised in cancerous. For many conditions, it is raised. But it shows that there is an ongoing inflammation. If it is very high, then it's very serious. If it's very low, then there is something minimal which we have to identify. Next slide. Another cytokine marker, specifically interleukin 6. There is a pro-inflammatory cytokine produced by the macrophages, especially adipose tissue also. And this has a very much important role, those for diabetic, especially the resistant type 2 version of the type 2 diabetes, cardiovascular and autoimmune diseases. This is most important one. If you go for interleukin 6 marker is present, then you have to see that there is something which you have to pay attention. Next slide. Now, TNF factor, tumor necrosing alpha factor and beta factor, which both has to be checked. They also pro-inflammatory, especially in these chronic inflammatory conditions. If you doubt anything, if normal treatment is not working, then you have to go with TNF alpha and TNF beta. Take next. Additional things. This is ferritin. You might have all known that whoever underwent this corona period, they went for ferritin test. During corona, CRP and ferritin were common blood tests which were tested. Ferritin is the iron storage protein. If there is too much of protein released, it indicates there is a chronic inflammation is going on, which may be a threat to our body if it is highly increased. And this is also indicative of oxidative stress and iron overload in the body. Next slide. One more is fibrinogen is also tested, but these are not tested in a common factor or the common day-to-day practice. But to knowledge, you should know that when we should test this, especially if the liver is ailing or the liver element is there is a problem, then you need to go for fibrinogen test. Also cardiovascular. Next slide. Complete blood count. This also indicate for the lymphocyte and macrophages ratio, neutrophil to lymphocyte ratio is most important for our body. Next slide. Now we all know general inflammation. Any non-steroidal anti-inflammatory drugs can be given. Sometimes steroid can be given. Steroid we will not discuss in detail about the steroid treatment because it is not the part of discussion of our today's webinar. And steroids can be given tapering dosage or depending upon the condition. Next slide. Now, how to treat this in a better way? I'll come to Ayurveda. Nutrition is the first goal of treatment should be there in case of anti-inflammatory defects. That too, especially first is the polyphenols. Many drugs which has polyphenols can be taken, and those polyphenols help you to scavenge these elements, polyphenols. And after the polyphenols, healthy fats. Healthy fats, for example, best healthy fat, you can say many things, but I consider avocado is the best healthy fat for vegetarian people. Non-vegetarian, fish oil is the best healthy fat which you can take. Okay. Next is the fibrous foods, dietary fibers, especially because it supports the gut bacteria. When the gut bacteria is best in its phase, it removes all, scavenges all this naturally. Next, what are the trans fats? What you have into food for the all these fried foods, KFC chicken, burgers, all these are inflammatory. So you have to stop this and go for the better healthy food. Next slide. Now, how to do that is restoring the balance through lifestyle synchronization. How to do this lifestyle? You have to have the best first part is the sleep. Don't deprive your body for sleep, or the patient you have to advise 7 to 8 hours of good sleep, alpha wave sleep is most important so that your body scavenges all these chronic elements which are released. Even every day, every person's body is releasing cancerous cells, but they are mutated and thrown out of your body only by sleep. Your sleep is having the good recovery process. Next is stress balancing. Stress breathing exercises, breathing patterns, whatever you can balance, pranayama or omkara, whatever you can balance. Next is the exercises, physical exercises, so that sweat is another example of throwing away the toxic elements from your body. And you can also have the thermal treatment, that is cold and hot exposure at a time. Next. This is one more 4-week protocol. Next slide. Next slide. Now you want to see the Ayurveda version. What is the nature of inflammation? How Ayurveda is helping this chronic inflammation? What is the thought of Ayurveda in chronic inflammation? Can we deal with the in chronic inflammation through Ayurveda? If anybody asks, the answer is yes. Ayurveda identifies chronic inflammation. Charaka only has beautifully explained that. What he says is sometimes he said that it is Pranashota, Shota also. Prana is not the Shalatantra Prana. There may be Upagata or Abhigata. Abhigata is external injury to the body. Upagata is the injury to the body through doshas. If you understand the 18th chapter of the Sutrasthana, Charaka Sutrasthana, it is named as Trishotiya Adhyaya. Why Trishotiya? What is three here? The Trishotiya, he says, the importance of Tridosha in Shota. The Tridosha in Shota, hence he has named it Trishotiya Adhyaya. So we have to understand the Trishotiya Adhyaya. If you understand the Trishotiya Adhyaya, you can know what are the things which are present. Next. Here you can understand there are key inflammatory signals, that is the prostaglandin, cytokines, histamines, macro. These are all given in the body, and this acute versus chronic we have to understand. How we have to understand, we will see. Next slide. Ayurveda inflammation, right? Now, Ayurveda inflammation understands Shota. So here we have, some people say that chronic inflammation cannot be correlated to any specific condition or any specific disease in the body. But according to my experience, my knowledge, it is clearly indicative of the Shota. Shota is one such disease entity wherein Charakacharya explains this is inflammation is the primary element of disease. We'll see one by one. Next slide. Now here it says the etiological factor. Now you can read the etiological factor. Nijaha, that is the not Agantuja. Sneha, Sweda, Omana, Virechana, Astapana, Anusana, Shiro Virechana, all these things she explains, different diseases she explains. Later it says different consumption, Madhya, Mandaka, Virudaka, Shuka, Shami, Danyaka, all these if you are taking in wrong manner, excessive physical activities, Mityopachara, Udirana, Shoka Pradurbhavanti Idyukta Samani Hetu. This is the Tridosha involvement of the doshas, which Charaka clearly explains all these elements which may cause the disease, that is shoka. Next slide. Now, what are the treatment you can understand? Before going to that, just previous slide. Sorry. I will not put this local just Charaka says there are multiple varieties of diseases. One such variety, for example, allergic dermatitis. He says, Yasya pittam prakupitam tvachi rakte avatishtati shotam saragam janayet vidaka tasya jayate. You can see allergic dermatitis, there is all the facts which is happening in this skin dermatitis with allergy. That is saragaha, redness is there. That type, there are multiple versions. If you see the Charaka Sutrasthana from 19 to 34 sloka, different versions he explains. Later, what he says, you can see that is very beautifully. He says that what best we can do. There are multiplicity of this. There also he says, Vikaranam akushaluho na jirvyanti kadachan nahi sarva vikaranam namato asti dhruvam sthita sa eva kupita dosha samuttana visheshata sthanantaragataha based on different sites, different location. You can have the name of the disease. Here also we says tuberculoid version is there, tuberculosis. Cancerous is there, cancer. Bronchitis is named. Dermatitis is the skin if it is affecting. Dermatitis is what is being named. So likewise, where and all the dosha goes and sits in its deposits, that is yatra sanga kaviguna tvadis tatra upajade. Based on this, there is a disease. Now what happens? How to treat this then? Next slide. See, this is the simplest drug which is used, which is known to everybody, but not used for this condition. That is Triphala Guggulu. Tripalam, Triphala Churnam, Krishna Churnam, Phalanmitam. And lastly, we see Pagandaram, Gulma, Shota Arshas. Shota here refers to not any big shota, it is the inflammation. So any inflammatory conditions, rather than giving an anti-inflammatory, conventional anti-inflammatory drug, you can use this anti-inflammatory drug which is present in Ayurveda. That is Triphala Guggulu. This Triphala Guggulu, if you give, it acts as in pro-inflammatory and it is also affecting the other conditions also. But main is the Shota. Next slide. One more beautiful drug is Dashamula. Dashamula, if you take, it is also Vatara, Kapara and Shotara. Dashamula has many conditions you can treat just by Dashamula. I would just like to quote one of my example. When I was in Agra, in consultant, he was an MD colleague. He came to me and said that his mother is having pyrexia of unknown origin. From 5 years, she was suffering from pyrexia of unknown origin. I don't know what went to my mind. He came to me and he showed, and I just could not, physically did not come. I just went on to examine her through mobile. I took some video conference and they checked. And to my surprise, you believe it or not, if Jora is there, usually some people may give Amrita Arista, I just gave the Samularist. And very third day he called me and that fever is gone and she is healthy. And he told all the doctors over there that I cured just by the Dasamularista. I did not cure, it is the Dasamularista which cured by because it relieved the chronic inflammation. I don't know where the chronic inflammation was there, but I found that Dasamularista would be effective there. So Dasamularista cured pyrexia of unknown origin for more than 6 months to 1 year and repeatedly all blood tests were normal. This is the beauty of Dasamula. We don't use Dasamula because we don't get the complete 100% good quality of Dasamula. There are many things which are replaced and the what we call replacement drug is used. But if you get wonderful Dasamula, it is best to Vatara, Kapara and Shotara. Now these are the Shota Dasamani drugs which has been explained by Charaka. This Patala, Agni, Shwana, Kabilva, Kashmira, Kanta, Bruvati, Shalmari, Kushtavarni, Gokshura is added. So these are the Shotahara drugs which can be used. So here you understand this Shvatara, Shotara is almost same. Some people think inflammation is because of Pitta. There is no, inflammation happens by name is inflammation. But the thing is, here we have to understand the kapha dominance also. Next slide. Now, the role of ama in chronic inflammation. This ama is the root cause for inflammation. No doubt this has got a wonderful role in that. Now, when this Agni is weakened, there is an, you all know, Pratham Dosha, Pratham Kechittu, Ama Malasanchaya. So, in that condition, the weak Agni, you have to have the ama condition. So, to check for the ama. Without ama, there is no disease in Ayurveda, we say that. But Jatragni Mandya, Datvagni Mandya, which you have to rule out. Depending upon the condition, you have to rule out and you have to treat the Datvagni or Jatragni. Next slide. Now you see the treatment aspect which is explained for show the general treatment. What he says, very beautiful, it is a general Chikitsa Sutra, but today also it is applicable for all the chronic inflammation. If there is ama, do Langana Pachana. If there is dosha ulpana, the prabuddha dosha is there, do for Shodhana. If there is Shirogata doshas, Shiro Virechana, or Adagata Roga is Virechana you do, otherwise Urdhva Gata is there, then Urdhva Hara Chikitsa is done. Then if there is Sneha is there, means Sneha is there, do for Virechana, or sorry, Virukshana. Then if it is Rukshana is there, go for the Sneha Vidhi. Vipat, stools are hard, dry, flatus is passing, go for Niruhana Chikitsa. If Pitta is there, Tikta Grita should be given. Payasa should be given in case of Murcha Arshitaha. And Shodhana should be done with the Mutra, Gomutra, if there is Kapha is there. And also, Shara should be used. Shara is used with Ushna Dravyas. This is how we have to interpret. Next slide. Then you can take. Now you can see here. These are the different conditions. Amajas Langaja Pachana. And now you have to understand this. You have to treat the conditions. Next slide. Now, Susruta explains, Adav Vimlapanam, you might have many practices have beheaded this sloka. Adav Vimlapanam, Kuryat Didiyam Avasechanam, Upanaham, Patanakriyam. If there is an external thing, then Patanakriyam. Shodhana is also there. Ropana is not only Vranaropana, it is also the healing process should be activated. This is how you have to understand. Healing process should be activated. And then Ropana Kriya, then you have to see the Vaikutapaham. What are the derangement which has happened? You have to treat that condition. Next slide. Now, in building the immune response for the body, how to do that? What are the Vyadi Pratirodhitva? We all know that Vadik Shamatva we read. How to build this Vyadi Pratinika Chikitsa or the body's immune response should be activated. In that case, Ojas has got a very good role to play. Ojas, we all know, especially why the diabetic people will have many complications, because there is an Ojo Visramsa is happening. Ojas is going through urine. Ojo Visramsa happen. Hence, that is there is a complication. All this neuropathy, nephropathy, retinopathy, all this pathy comes because there is a Ojo travel. How to regain this Ojas? How to enhance this Ojas is only through Rasayana. Next slide. Key principles. How to no. That is through Rasayana. What Rasayanas can be given? This Rasayanas will help the body to regain its strength, will enhance the toxic elements is removed from the body and vitality is enhanced. This depleted Ojas is brought back to normalcy. Nourishment is given, with the vitamins is given through Rasayana therapy. How Rasayana therapy is followed? Only after Shodhana. Depending upon the condition, Shodhana is done, and after the Shodhana, Rasayana should be administered. Next slide. No, you know that we got things. Ojas is the primary thing. Agni should be done. Nidana Parivarjana is done. Next. Now we'll have one. I have just elaborated the one. Amvata as a case study. Amvata is a chronic inflammatory condition. No doubt it is an autoimmune disease, but it is also an chronic inflammatory condition wherein there is an ama formation. Unlike in conventional system of medicine, they give anti-inflammatory drug also, but different versions of severe, which may affect. Whereas Ayurveda, we go for the root cause and remove the ama in the body, the root of the ama. We just don't treat in the superficial level or symptomatic treatment, where we do Shodhana Chikitsa is done. We do Basti is done. Basti, Vaitarana Basti is very effective to remove the ama. Or the Simhanada Gugulu is one of the best treatment in these cases, wherein it removes the ama. That is the reason it is named as Simha. It affects the, it kills the elephant also. Likewise, it is done. Next slide. In Amvata, what is the treatment approach? Heal the gut. That is the Deepana Pachana is done. Gut healing is done by Deepana Pachana. Primary thing. What is the drug which is best for Deepana Pachana? That is Shunti or ginger or whatever you can name it. That is the best drug which can be given. Now, if you understand the drug Shunti, what it affects, it has got the latest research capacity to whenever in our body there is an inflammation going on, the lymphatic drainage is not happening. The lymphatic drainage, the lymph is just like a syrup in the body. It's very hard to move. So if you give this shunti, it will liquefy within 3 to 4 days. That is the reason in most of the conditions of our Ayurveda, Shunti, Nagara, all these added. Especially in the Shota, if you read, all those conditions, there are different, what you can say, treatment which is planned by Charaka and the Chikitsasthana. If you read one by one, every condition is treated with the Nagara. That is the Shunti is given. Even Shilajitu Prayoga is with the Shunti is should be given. Why? Because it should activate or channelize the lymphatic system. That is the beauty of the Shunti which has to give you. And once this ama is addressed, then you can go for the different treatment based on the symptomatic conditions. And once that condition is improved, the persons will have the curative version, not only symptomatic version. Next. You have the Prakriti, which is the blueprint. Based on individual's body type, you have also addressed this, the basic question. Because if you don't address this properly, then there may be some difference in their response also. Next. Next. Next slide. Abhyanga. I would also like to enhance the Abhyanga. Just by Abhyanga also we can treat. Why? What happens through Abhyanga? Abhyanga is just a body massage, applying oil. Because you see, the entire body, the biggest organ is skin. So whenever there is a bacterial development, where the bacteria is sitting in the body, not inside, the most of the bacteria which is affecting the skin, they underlie skin, the sweat process. If at all some person's sweat is very foul smelling or bad smell is there, that means there is bacterial growth in the skin, which you cannot identify. If you go and do the blood test, the total count is normal, but there is a bacterial deposition in the body. That is the reason there is a bad smell of the sweat. The sweat water doesn't have any smell, but when it combines with this bacteria, dead bacteria, then there is a smell. So when you do this Abhyanga, this bacterial growth is not happening. It is a lipid media and it is thrown out of the body. It is also a type of cleaning procedure by which you remove the proactive elements. One thing. Second thing, by doing the movements, strokes in the body, you channelize the lymphatic drainage, you move the lymph system, and there is a cleaning process in the body through which also you are treating or you are addressing the chronic inflammation. Next slide. Now, turmeric is one of the beautiful anti-inflammatory drug. If you see that in many Shota conditions, turmeric, that is the Haridra and Daroridra, both are explained. Some conditions. Now, today you can see that Haridra Nishamalaki is wonderful drug which is being addressed for the type 2 diabetes. Type 2 diabetes again a chronic inflammatory drug. And also, if you see Daru Haridra, it is called berberine. Now they are telling berberine is the most potent drug, more equivalent to your metformin, okay, without side effect, and which is very wonderful for all this what do you call the type 2 diabetes. there is a insulin resistance which is happening, that is cleared by, why it is not clearing any, it is not improving the sensitivity, it is just addressing the inflammatory process which is there in the body. It is clearing this shota which is there, or and ama which is there, this is there. But what we have seen is, if you don't take this haridra with maricha or black pepper, then the absorption rate is only 10%. If you take with pepper, for example, 1 gram with 100 mg, 1 gram with 100 mg, if you mix it, the absorption is 200%. Haridra absorption is 200%. But if you don't address with this maricha, then there is a, what best you can do in your practice, you cannot just have the maricha, you can mix with thickener. Thickener would be best drug. So 100 gram with 10 gram of thickener, then you can make powder or tablets or whatever form you can, or give with the haridra milk, you can give, so that every day if you give it, there is an anti-inflammatory process which is happening in the body. This would be the wonder process. If you don't mix with the maricha or black pepper, then there is only 10% absorption, and the prolongation of the treatment may be there. If you mix with the maricha, then the enhancement is 200%. Next slide. Ginger, I already told. And there are many things, shalaki, gugulu, ashwagandha, depending upon the type or affected of the organ, tissue, then you have to select the different drugs. If it is joints, you can go for shalaki. Gugulu is again a general word. Ashwagandha can be best for stress. Mental stress, if it is there, then you can go for the ashwagandha. Next slide. Lifestyle modification is most important part of our life. One is you have to do the dinacharya. Adopt your life and eat the fruit which is required for your body and which is grown in that place and which is that seasons. If you eat mango in December, it is not good for the body. Mango may be grown, but mango is not that season. Mango season is only mid-May to mid-June. That is the best time to eat the mango. Unlike other time, if you eat, body may not be in that position, or the rutu may not accept that fruit. There are certain fruits which are grown every time that you can have. Other times, other fruits are there. That is called seasonal fruits. There are multiple international fruits available. You can have that also sometimes, but you have to be very careful. Some body may not accept that. So you have to understand that, and you have to be very specific. And rasayana, which is Rutu Haritiki rasayana, is also best for these things, because every Rutu needs different. Haritiki will be same, the Anupana is different. You can enhance that. And all the general yoga asanas, especially I suggest Surya Namaskara would be much better rather than learning any other thing. You can just go with it. Surya Namaskara. By Surya Namaskara, what you can do, you can just do that. Just 10 Surya Namaskaras you can practice. And also, you can go for the Nadi Shodhana if you can perform, or else you can just go for the Omkara. Omkara should be 3:1. 3% is O and 1 is Makara should be done. And one more beautiful thing is, whenever you have a mental stress and you go low, just tap your head 7 times to back. 1, 2, 3, 4, 5, 6. Then your mind is triggered. There is a stimulation. This tapping method. This stimulation also affects, and this will not have the chronic inflammation phase to your body. It can be relieved. Next slide. Next slide. So, what foods you should not have, what you should have, depending upon your healthy lifestyle, you should understand what can be done. That's what all these tastes your body needs, your prakriti, your age, your place, and your person residing at an coastal area. Then they eat Vatakara, whereas Jangala Pradesh, again different. Depending upon all your needs of the place, time, age, you ought all consider those, and different foods you have to select, and then you have to decide. That is most important for that purpose. If you don't understand that, or if you don't decide that, then it can be a general rule. I don't give to general. This is just generally I will tell you, but general rule cannot be done. Okay, you should be very particular regarding that. Next slide. Next. No, integrated management is most important for the future inflammation management. In that way, you do modern science for the diagnosis and the treatment and management through Ayurveda. Next slide. For the longevity, you need to understand to live long. Chronic inflammation is very invincible. You cannot have this understand suddenly straight away. You never think of a chronic inflammation as a disease. No doubt it is not a disease, but it is a pathological entity. But that pathological entity can trigger many diseases. Once it gets converted into the vyadi from vikara, then it would be but difficult because already with that word is a chronic is there. Your body may not respond because the derangement is already done. So that I suggest every time when you have in practice, you think of these biomarkers to have the test, and by that, if you understand, you can have the better treatment depending upon it. Anyhow, in Ayurveda, people will have the different versions of the Shodhana. If they understand that, they will do that. And after Shodhana, the treatment methodology, add one inflammatory drug. If you don't understand anything to add just Triphalagolo, you will do that. Thank you. If you have any doubts, please tell me.
Dear participants, the session is open for questions. If you have any questions, you could type in the chat box or you could unmute yourself and ask the question. Dr. Savita, thanks for the very informative session. Doctor, I guess we do not have any question.
Thank you, madam.
Sorry, sir. We have a question here by Dr. Javed. Yes, sir, the role of Shirodhara in chronic inflammation. Any experience you have regarding the same, sir?
In chronic inflammation, it may not have any role, but it will relieve the stress. The stress is the causative factor for the inflammation. It cannot relieve the inflammation. But again, dhara is a procedure. But what you add to dhara, that also depends. Sometimes you can go for a taila dhara, takra dhara, and takra also you can add many things. Amla kshira dhara is also done. There are many things. The amla dhara, kshira dhara, multiple things are done. Especially Shirodhara is a treatment methodology, but what you add to it depends. But in my experience, it only relieves the inflammation, not the inflammation, but the cause for the inflammation is going down. Then you can have the better benefit. The stress is relieved because it is treated with the Agna chakra is stimulated. There is a stress is relieved.
We have another question.
Chronic urticaria more than 6 to 8 weeks. So in my practice, what I give. Initially, I start with Haridra Kanda and Lagu Sutra Shakara. If the urticaria is still persisting, I use a drug, especially it is used for other drug. The best drug I use is Sarpakanda Ganavati. Sarpakanda Ganavati, it relieves the Shota. It is again explained by Sushruta for the Kusta and Shota. Therein it subsides the irritation process. But the Shota, again, I go for Haridra Kanda. Inflammation, Haridra Kanda. Whereas for the severe irritation, Sarpakanda and Lagu Sutra. Lagu Sutra reduces the Pitta, Shota is reduced by, or the chronic inflammation is reduced by Haridra Kanda, and the severe urticaria, if it is not coming to control, then sometimes for 1 week or 10 days, I add Sarpakanda Ganavati.
We have question by Ganga Devi AI.
SMC. Generalized inflammation versus localized inflammation treatment. Localized inflammation, local treatment. Generalized inflammation, general treatment. General treatment refers to general. That is the reason we said the biomarkers should be taken. Depend on the symptom. Ayurveda says depend on the symptom. If it is localized symptom, go for the. For example, if it is Urdu Jatrugata Vikara, go for the Shira Virachana. If there is an other shaka is there, then go for the Virachana. If it is Urdhva or the lungs is involved, then go for the Vamana. That is what has been explained. There is just a small areas, then go for Pradeha Chikitsa or Amapachana Chikitsa, or any swelling is there, or chronic swelling is there, which is hard. Go the Adho Vimlapanam is also explained, that can be done. Generalized information, generalized treatment. Specific is specific. What is the medicine used for acute inflammation? Acute inflammation is not the point of discussion of today. Still, acute inflammation, depending upon the area of acute inflammation, you have to treat it. That is, that sometimes it may repair by itself, because the third stage is the healing process. Third stage is always the healing process in acute inflammation. It's a short course. The body repairs itself. And the body, when it is not repairing, then it is body sometimes repairs by itself. Suppose you fall today, you get injured at your shoulder joint, and there is an inflammation. It repairs by itself 2 days. You can apply any liniments or any oils or anything, you can add it, and they reduces that. And if it is not reducing, then it converts to chronic inflammation. Treat the acute inflammation depending upon the causative factor. Sir, in COVID, we have seen surge of interleukin and rise of ferritin level. Yes, of course. How have the place role in it? And we have seen some botanical colors being used in the same. Any experience in yours? See, COVID-19, I'll just wait 2 minutes to explain. Many deaths were happening. I am not commenting now what happened. It had a 3 phase. According to my experience, I have seen, I have treated. It has 3 phases. 16 days or the total protocol of the COVID version. First 6 days, the virus is there in the body, it is hampering your body, it is bombarding your body, and then COVID virus is gone after 6 days. No, you must then why there were deaths. After 6 days, what it has done, all the ruptures in your body, and there is a release of this interleukin 6 and ferritin. And it is releasing the bleeding is happening in the body. Because of the bleeding, there is a blood clots happening. Now, the blood clot is there. The blood clot body is not able to clear so fast that the imbalancement is there in the lungs, and there is a restrictive lung disease. The air is not able to go. That is the reason whatever you do, lung is not able. All were given to blow things. Now you have to see that in the first 6 days, you see that this inflammation is reduced. That was the reason low molecular weight heparin were given, with the steroids were given. Steroid was again for the chronic inflammation. There it was given. In Ayurveda, what you can do, all these hemagarbha potentially rushes, many people did many things. And you had a best drug which was came into Ayushvata. The name was Ayushvata. Ayushvata, what it did? There is an again, Maricha is there, Shunti is there. Shunti is what? Again, anti-inflammatory. If you start this Ayushvata on the day 1, by the end of day 6, the imbalancement, the bombardment which is done by the virus was very low, and people cured. And again, I have my personal experience. What it was, I don't know. I cannot explain that. A positive, B positive, AB positive, they were affected more. O positive, O negative, O persons, there never happened any such cases of death or thing. Most of them did not have, even if they walk by the ICU ward also without mask, they did not get disease. For that, I don't have any answer, but it was my observation. Any other thing?
No. Okay, there's another question, I guess, Doctor.
Can infection occur without inflammation? Infection itself causes inflammation. There are multiple varieties of infections: bacterial infection, fungal infection, parasitic infection, or the proteozoic infections. All this infection will cause inflammation, by which there is a disease formation. See, inflammation is a pathological entity. The cause may be multiple things. It may be physical, chemical, or intellectual. This affects the inflammation. How it is biological is one of that, which is infection happening. This infection will cause inflammation. So the question should be changed. Can inflammation happen without infection? Yes, it can happen. The infection will cause inflammation. Of course, it has to cause inflammation, without which you cannot have the disease process. Your body fights infection, then there is no inflammation. Sir, last question. Last, CKD is inflammatory condition. How to approach it? See, that is what stage you are approaching is most important. Is the kidney damaged? What amount of kidney is damaged? 1, 2, 3, 4. Yes, depending upon that, you have to understand to treat the kidney. Now, however we treat, Upadrava is treated first or Vyadhi is treated first. If the Upadrava is very strong, treat the Upadrava first, then come to the Vyadhi. The inflammation, repeated inflammation to the kidney. Kidney is affected, injured. It is trying to recover. It cannot recover. Then there is a chronic inflammatory disease. So you cannot straight away go for the inflammation. So best drug what we can use, Punarnava is the best drug I can try. Shilajit is the good drug. So wherein it can relieve the inflammation, and once the inflammation is relieved, go for the nutritional foods. These nutritional food stuff will help the recovery process. If you see nowadays, what the treatment they do, you go to an renal specialist or whatever the doctors who said MCH, what they treat, how they treat, they give multivitamins. That is what they treat. Dialysis or give multivitamin. Only multivitamin, that will affect the multivitamin will reduce the inflammation. How they will reduce the inflammation? They will clear these macrophages because there is release of antioxidants. Free radicals is thrown out, scavenging happens. By this, the body repairs. It is not the drug which is repairing. The body repairs because these cells are thrown out of the body or they are suppressed. That is how. Even you can see acute renal failure or there is a kidney nephrotic syndrome. What we give in nephrotic syndrome? It is steroid what is given because to act on the inflammation. So you don't have inflammation for the steroid, you give your drug, Ayurveda drugs, which are Mutrala or which are Punarnava is the best drug I can suggest to Gokshura, Punarnava. These things you can use. Okay.
Doctor, I have sent something on your WhatsApp. Could you please have a look at and if you can speak a few words about it?
Yeah, I am using this Geritone. This tablet it is wonderful drug because if you see that, if you read the contents of this drug, Punarnava Mandura is there. Punarnava Mandura, especially if you see Punarnava Mandura is prepared by Gomutra. Punarnava is there, Mandura is there, but after Bhavana with the Gomutra, right? Punarnava is Shotahara, Mandura is also Rasayana, is the Loha, it is a Rasayana, and you can add that. Again, Rajanyadi Churna has been added, that is Haridra, what we discussed, it is an anti-inflammatory drug, wonderful anti-drug. Haridra Kanda also is said Ayurveda. Then Rohitaka is best blood purifier, what is being used, or the Rakta Shodaka, Bhumi Amlaka and Guduji Sattva. Guduji Sattva is a wonderful drug which you can use for the anti-inflammatory drug. So all this combination, it is being introduced in this drug. This is having a wonderful record because rather than adding 5 things, you can use only one drug and you can have this. This is a wonderful drug which you can have. Anything else? Madam?
Sorry, doctor, I was on mute. So I was just trying to display the iGeritone photograph on the.
Let's share the photos.
Yes, I'll just share the image so that all our viewers could have a look at our
Yes.
new product. Just a moment.
Madam, can I ask one question?
Yes, please.
Doctor, now they are talking about sea buckthorn oil, no? Sea buckthorn oil or pulp, it's coming. So, what are your views about it, doctor?
Sea buckthorn.
Yes.
See, sea buckthorn is grown near the cold conditions of Himalayas. I have seen, even I have once tried, used, very bad taste, very thick rasa. It is good, it is having the wonderful response, but it's more pitta karaka what I have seen. So depending upon the individual condition which is required, you can try it. They say it has got wonderful antioxidants, but my experience is it is pitta karaka. So where the conditions are less, just like Lasuna where you cannot use in pitta conditions, same wise you cannot use, my personal experience, I'm not giving as a hard rule, my experience says you cannot use this in these pitta conditions. Other than vata and kapha conditions, I think it's wonderful drug.
But I have read somewhere like that sea buckthorn oil is more effective for dryness and all. But now sea buckthorn pulp they are giving in ice
Any
and all.
oil is effective in dryness.
Yes, doctor. Yeah. And the omega-9 or something is more in that, they say. So that way, anti-inflammatory, they say. That's why I just want.
See, that's what I'm telling. Antioxidants are huge, but if you see, I just forgot. I made a seminar on COVID-19, how to understand. If we see that, I don't remember what the score. There is a score. If you see, go on the world's best drug with antioxidant, which has got high score. Can you imagine which is the high score? I think some score is there. I forgot that score. Which is the best antioxidant score? If you can just have a guess. You daily use it, I suppose, in your food. It is clove.
Oh yes.
Clove is considered to be one of the best drug for all. I have that. There is a score. On that scoring basis, if you use clove on daily basis, it is the wonderful antioxidants. I'm not telling that sea buckthorn is bad, but when you have a very simple thing at your kitchen remedy, why do you run for all these costly elements? The company is making good amount of money by selling all those things. You may get it to 100 rupees, but they sell it for 1,000 rupees 1 liter, 2,000 rupees. I am pure, he is pure. All these things are we don't know. We are not seeing what is pure. Even if we give some colored flavor, also we don't know. Right? We have not seen sea buckthorn. We are not here. We don't grow also. So the purity and genuinity is again a question mark. Rather than go for a moringa. Moringa is a wonderful drug which is available. For me, I say that is the reason I said go for the seasonal one and go for the thing which is grown at that place. Rather than importing, the God has created such a wonderful thing by nature. The thing which is required for that place is grown at that place. If there is a disturbance in the season or there is changes, that thing is not grown because that is not required there. So it is not grown. So your body needs, it is grown there.
Okay, doctor. Thank you.
Okay. Doctor, shall we conclude the session?
Yes, madam. Thank you. Thank you, everybody.
We are very proud to present our 4 new unique products, as the one of the products is already displayed to you, Igeroton, which specifically aims at regulating CRP as well as IgE production in the body. Reduce creatinine and to support the kidney health in chronic kidney diseases. Also, we have MigraCool for migraine. So we'll be sharing all the product details on your mail ID. So kindly have a check and get back to us for any further information regarding these 4 new products. So we come to the end of this enriching session. So I would practical insights, and I'm very sure these days, because of the lifestyle, most of the times, even these days I'm seeing, even the college students who go through the stress, so even they are also coming up with the symptoms related to the chronic inflammation. I'm sure today's session will help all of us to address the disease beyond the symptoms and to look into the root cause. So, all the participants, I thank you so much. So thanks for your dedication towards Ayurveda, commitment to patient care, and willingness to share your knowledge today. I would also like to thank all the doctors, practitioners, students, and participants who joined us today and contributed to their active participation and thoughtful questions. Our sincere gratitude goes to our central and the sponsor of this academic initiative, and Ayurveda One, our co-powering partner, for their continued support in creating meaningful educational opportunities for Ayurveda One committee. Ayurveda community. I'll be sharing the dear participants. Once again, I request all of you to kindly fill in the Google form for certificate because we duly send the certificates to the people who has registered with us. I mean, attended the session, but then some of you come back asking that we have not shared the certificate. So kindly help us to do this activity without any kind of a hassle. So I'm sharing you the form over here in the chat box. So kindly fill in that box. I'm also sharing you our WhatsApp community channel. So kindly join the channel for future updates on our session. And I also share our YouTube channel link. So those who have missed to join the session from the start and you would like to visit the session from the start. So our YouTube channel will has all the sessions recorded and displayed. So you could always go back and have a look at the session. So for any product inquiries, I'm dropping the email ID. So kindly reach us out for any information regarding the products. So thank you once again for being a part of Insight. We look forward to welcoming you to our future session. Until then, stay inspired, stay rooted in Ayurveda, and continue making a meaningful difference in the lives of your patient. Have a wonderful day ahead. Thank you.